Continuation of the previous video, regulation of hypersensitivity type 1. The allergenicity of an allergen, or in turn the level of IgE response by an allergen, depends upon various factors such as allergen dose. Dose of an allergen is a critical factor for defining the allergenicity. For example, repeated low doses of allergen has been shown to induce a persistent IgA response in BDF1 mice, but higher dose results in transient IgE production and shift towards IgE. Genetic constitution of the individual. Some strains of mice, such as SJL strain, do not mount an IgE response to allergen, whereas some other strains, such as BDF1, has high propensity for IgE production in humans. Genetic component has been shown to influence susceptibility to type 1 hypersensitivity. If both the parents are allergic, 50% chances are there that their child will also be allergic. And if one of the parent is allergic, chances are 30% of the child will manifest the symptoms of type 1 hypersensitivity. These examples clearly indicate the role genetic constitution of an individual plays in regulating the allergic response of an individual for an allergen. Mode of allergen presentation. Immunization of Lewis strain rats with keyhole impact lymphocyanin KLH with an aluminium hydroxide gel or Bordetella persiensis as an adjuvant induced a very strong IgE response, whereas KLH with complete fruits adjuvant produced largely an IgE response. It shows that the mode of allergen presentation plays an important role in defining the response of an individual to a particular antigen. So, relative level of Th1 and Th2 cytokines derived from Th2 cells in IL-3, IL-4, IL-5 and IL-10 stimulate the type 1 hypersensitivity, whereas the cytokines released from Th1 cells, IFN gamma, inhibit the type 1 hypersensitivity. IL-4 and IFN gamma particularly play a role in stimulating or inhibiting the type 1 hypersensitive responses respectively. And since IL-4 and IFN gamma are secreted from Th1 and Th2 respectively, the relative activity of these two cell subsets regulates an individual's response to allergen. Then, a detection of type 1 hypersensitivity. The identification and assessment of type 1 hypersensitivity can be done by a number of medical tests such as wheel and flare test. The simplest, inexpensive and easy testing mechanism for type 1 reaction is skin testing, where an intradermal injection or superficial scratching of potent allergen is applied on surface skin sites, preferably arm or back of the individual. If the individual is allergic to that particular antigen, localized wheel and flare reaction is observed within 30 minutes due to mediators released at that site. Advantages: simple, inexpensive, fast and arrow screening of large number of allergens at one time. Disadvantage: it may cause systemic anaphylaxis, tissue damage, late phase reaction and sensitization of allergic individuals to new antigens. Sterile needle, positive test area becomes in suspected antigen. Positive test area becomes red and swollen. A number of suspected allergens are tested on the arm at the same time. Wheel and flare test for assessing type 1 hypersensitivity against multiple allergens. Then radioimmunosorbent test, ARIST. It is a radioimmunoassay based highly sensitive technique which determines the total IgE in patient's serum. In this method, patient serum is reacted with rabbit anti-IgE coated on paper disc or agarose beads. After washing, radio-labeled rabbit anti-IgE 125I labeled is added. The radioactivity of beads or discs is measured by gamma counter, which responds to the amount of IgE on the patient. A simplified pictorial depiction is seen. Paper disc or agarose bead. Anti-IgE coupled to solid phase. Patient IgE. Radio-labeled anti-IgE. Count pound label. Then radio allergosorbent test, RAST. Unlike RIST, where total IgE in patient serum is detected, RAST is used to detect serum IgE specific for a given allergen. In RAST, the allergen is coupled to a solid phase and then reacted with patient serum. Unbound antibodies are washed away. The remaining allergen-bound IgE is reacted with radio-labeled rabbit anti-IgE and 25I labeled, and then by radioactivity is measured. Fluorescent labeling can be used instead of radioactivity in both wrist and rust. Allergen coupled to solid phase. Patient IgE, non-specific IgE is washed away. Bound allergen specific IgE, radio-labeled anti-IgE, count blood label. Theory precaution for type 1 hypersensitivity. Starting from the exposure of allergen to production of atopic disease, there are several points which can be targeted for therapy. These points can be avoidance of allergen. The first step in controlling type 1 hypersensitivity is to identify and avoid the allergen itself. Though most of the time it is impractical to keep oneself away from all the allergens, but still measures can be taken to avoid the known allergens like dust, pests, pollens. Modulation of immunologic response. Immunotherapy with repeated injection of low doses of allergens has been a long-term practice for minimizing the severity or even elimination of type 1 reaction. Hyposensitization. Such repeated injection causes a shift towards IgE production. Immunology with repeated injection of low dose of allergen has been a long-term practice. Such repeated injections cause a shift towards IgG production or T-cell mediated suppression that turns off IgE response. IgG here is called as blocking antibody because it competes with IgE for allergen and binds with allergen so that it is not available to cross-link bound IgE on mast cells and thus freeze the allergic reaction. Then stabilization of the triggering cells. Stabilization of the triggering cells. Drugs such as inhalant isoprenaline and sodium chromoglycate render mast cells resistant to triggering. So sodium chromoglycate blocks calcium ion influx into mast cells and maintains them in normal resting physiological states. In this way, mast cells are inhibited from degranulation, chemotaxis, and mediator release. Then antagonism of mediators. Various antagonists of type 1 hypersensitivity mediators have been employed to cure allergy. Histamine H1 receptor antagonists, beta 2 antagonists, salmeterol, formoterol, leukotriene antagonists, phosphodiesterase inhibitor are some of such examples of mediator antagonists attacking chronic inflammation. Some drugs have impeding effects on atopic disease at many stages. For example, cetirizine has its effect on histamine receptor and eosinophil recruitment both. Similarly, corticosteroids stabilize macrophages and inhibit activation and proliferation of the Th2 cells. Other examples include budesonide, mometasone furoate. Block CA2 plus influx in mast cells. Some effects are there. Mediate mechanism of action. Block histamine receptors and target cells. Stabilize the mast cell triggering. Then act as bronchodilators and protect against bronchoconstriction. Prolongs high CAMP levels in mast cells. Stimulates CAMP production. Block histidine to histamine conversion. Stimulates CAMP production. Now let's have a summary. The concept of allergy is given by von Perket in 1906, refers to overall response of an individual to an antigen. If response is protective in nature, it is called as immunity, whereas the harmful deleterious effects due to inappropriate immune responses are hypersensitivity. Another term for similar response was proposed earlier by Richard and Portier. It is not overreactive immune response. Cook and proposed a generalized term hypersensitivity, which was classified by Gell and Coombs in 4 different types based on branch of immune response involved, time taken to show the symptoms, effect mechanisms, etc. Type 1 hypersensitivity is IgE based allergic reaction raised against allergens. It is a humoral immunity based immediate type of hypersensitive reaction like asthma. Type 2 hypersensitivity is IgE mediated cytotoxic hypersensitivity, which is also humoral immunity based immediate type of hypersensitive reaction. erythroblastoses fetalis. Type 2. Then type 3 hypersensitivity. Wait a minute. Type 1 hypersensitivity is IgE based allergic reaction raised against allergens. It is a humoral immunity based immediate type of hypersensitive reaction like asthma. Type 2 hypersensitivity is IgE mediated cytotoxic hypersensitivity, which is also humoral immunity based immediate type of hypersensitive reaction. Erythroblastosis fetalis. Type 3 hypersensitivity is immune complex mediated humoral immediate type of hypersensitivity. Example, rheumatoid arthritis. Then type 4 hypersensitivity is cell-mediated hypersensitivity, not humoral. It is cell-mediated immunity based delayed type of hypersensitive reaction, contact dermatitis. So type 1 hypersensitivity is an immediate type of hypersensitivity within a humoral branch of immunity which is induced by antigens called as allergens. It is similar to normal humoral immune response except the fact that plasma cells secrete IgE antibody in response to activation of allergen-specific Th2 cells. The compounds involved in type 1 hypersensitivity are allergens, airborne, foodborne, or drugs. Immune cells, Th2 cells, mast cells, basophils, B cells, various cytokines, IgE, Fc receptor for IgE, type 1 and 2, various mediator molecules like primary and secondary. The degranulation of basophils and mast cells is a key point of type 1 hypersensitivity. The generalized mechanism of type 1 hypersensitive reaction involves sensitization and degranulation phase. Sensitization phase include exposure to allergen, activation of Th2 cells, release of IgE from plasma cells, and binding of these IgE from Fc receptor or mast cells. Sensitization phase involve exposure to allergen, activation of Th2 cells, release of IgE from plasma cells, and binding of these IgE with Fc receptor of mast cells. Degranulation phase involves release of mediators on re-exposure of some allergen and downstream effect or functions. Clinical manifestation of type 1 hypersensitivity includes systemic anaphylaxis and localized anaphylaxis, allergic dermatitis, hay fever, asthma, etc. Various factors regulate type 1 hypersensitive responses such as dose and type of allergen, processing of allergen, genetic constitution of individual, and the relative ratio of Th1 and Th2 cells. Wheel and flat test, radioimmunosorbent assay, or RIST, and radioallergosorbent assay (RAST) are common medical tests to detect the type 1 hypersensitive individuals for a particular allergen. The treatment precaution involve avoidance of allergen, modulation of immunological response, stabilization of the triggering cells, antagonism of mediators, and attacking chronic inflammation. Various drugs are available to cure type 1 hypersensitive reactions below.